Coronavirus symptoms from China. What do we really know about this mysterious coronavirus from mainland China? The public should be paying attention but not panicking about a new virus that has recently spread from Wuhan, China to several other countries, including the US, public experts have said. The virus, known as coronavirus, has now killed, currently at the time this video is being made, 18 people and sickened more than 600, including a man in Washington state, although it is likely to have infected many more. Fears over its spread led Chinese officials to announce that they would temporarily shut down public transportation out of the city starting January 23rd. I think we will be a little concerned, but not overly so, says Jim Leduc, PhD, Director of Galveston National Laboratory at the University of Texas Medical Branch. The warning flags, he says, are the virus's ability to kill and the fact that it can be transmitted from one person to another, and its newness, meaning no one has had time to build up immunity to this virus. It has also arrived during flu season, where there are lots of other respiratory viruses that could make it hard to identify. And just before the Chinese Lunar New Year, when many people will be traveling to celebrate with their families and could spread the disease. That says further. US officials will force all travelers from part of China to come in through certain airports and be screened for symptoms of the disease. There are still many questions about the new virus, such as where it came from, how it passed to people, is it usually found in mammals, whether people can be contagious without showing signs of the disease, and how best it is to treat it, says W. Ian Lipkin, a professor of epidemiology at the Mailman School of Public Health at Columbia University in New York. So what is coronavirus? The virus belongs to the same family of coronaviruses that includes the common cold, but also severe acute respiratory syndrome, or SARS. In 2002 to 2003, a SARS epidemic sickened more than 8,000 people worldwide, particularly in China, Taiwan, Singapore, and Canada, and killed 10% of its victims that it infected. The main difference between the two outbreaks, Leduc and others say, is that the Chinese government is being far more collegial and open about the Wuhan coronavirus now than it was about SARS. The government has been releasing updated figures about the number of those sickened, and last week released a genetic sequence of the new virus, allowing scientists around the world to study it. We're certainly not out of the woods. There are lots of reasons to be concerned, Leduc said, but we're not being blindsided as we were previously. WHO officials said that 291 cases they had data so far. 72% were in people 40 and older, and about 2/3 were men. People with underlying conditions were more at risk of severe illnesses, they further said. So what are the symptoms of the coronavirus? According to the CDC, Center for Disease Control, a coronavirus usually causes a mild to moderate respiratory illness similar to the common cold. It usually lasts for just a few days. Symptoms include runny nose, headache, coughing, sore throat, fever, and general unwell feeling. Severe cases affect the lower respiratory tract and can cause pneumonia or bronchitis. These cases are more common in people with heart or lung disease or with a weakened immune system, as well as in very young children and in senior citizens. How quickly is the coronavirus spreading? Although official reports say about 470 people have fallen in with the new virus, Michael Nina, an epidemiologist at the Harvard School of Public Health, says he's heard that the figures are closer to 1,500 to 2,000 people. In general, the official reports are always a little bit delayed. He says, the speed at which we are seeing this transmit to other countries suggests that the actual number of people in Wuhan who are able to transmit the virus is probably in the thousands at this moment, which is one of the most concerning things, Nina says. So far, the coronavirus has been passed from Wuhan to several other parts of China, including 117 suspected cases in Hong Kong, he says, and to travelers in Thailand, Taiwan, South Korea, Japan, the US, and maybe even in Australia. The large outbreak and quick spread could mean that many more people are getting the infection but don't have any symptoms, Mina further said. If only 6 people have died out of the 1,500 to 2,000 who are believed to have been sick from the virus so far, then it is not as lethal as SARS and a similar illness called the Middle East respiratory virus, he notes. The American who fell ill, a man from Snohomish County, AA, north of Seattle, was immediately suspected of having the virus because of his travel history. A specimen sent overnight to the CDC confirmed his illness last Monday, and it was announced to the public on Tuesday. Mina says being able to rapidly test for the Wuhan coronavirus bodes well for containing an epidemic. It gives some hope that we may be in control because we are able to roll out a diagnostic so quickly, he says. Although there are a lot of unknowns, this has probably been the fastest response to date of any epidemic. What happened in Washington state? The Washington man, believed to be in his 30s, apparently traveled back from Wuhan on January 15th and started feeling ill 4 days later. It's not clear whether he could have been contagious on the trip home. Viruses commonly are transmitted before symptoms appear, Mina says, though that might not be the case with the Wuhan virus. Aware of the new virus, the man told his healthcare provider right away that he might have been exposed, officials from Snohomish County say, so his caregivers had the right protection. He was placed in an isolation room at the local hospital in an abundance of caution, but he is not extremely ill, the officials said during a Tuesday telephone news conference. State and federal officials started Tuesday to track any person who may have been exposed to the man during his journey home or in the few days after his return. The man told authorities he did not visit the open-air fish market in Wuhan, where the outbreak is believed to have begun, nor did he meet with anyone who was obviously sick, raising concerns about how he might have caught the virus and whether those who spread the virus must have displayed symptoms. The man from Snohomish County would not have been caught by such a screen because he was not feverish when traveling, but the effort is still worthwhile because it will contain a number of people who may have been exposed to the virus and will educate all passengers on how to respond if they become ill within a few days. Marty Setron, MD, Director of the CDC's Division of Global Migration and Quarantine, said during a Tuesday telephone news conference. Are there any treatments for the coronavirus? There is no medication just for this virus, although Leduc says experts in Galveston and other research facilities are working on possible treatments. Patients, including the man in Washington, largely receive supportive care, with 4 patients at home pretty much means fluids and a fever reducer like acetaminophen. In the hospital, supportive care can include many other measures, such as respiratory support for someone struggling to breathe. He says he has heard that some patients in China are being treated with protease inhibitors, antivirals that were developed to treat people with HIV and that were somewhat successfully used to treat the SARS virus. How does the virus suddenly appear? Although the virus is believed to have been first infected at the fish market, it is very unlikely that disease is spread by fish, Lipkin says. This didn't come from a fish, this came from a mammal, and the same market probably sells other animals, he says. The question is, what was in this market? Middle East Respiratory Syndrome, MERS, is spread by camels, he says, and SARS was believed to have been passed on by civets, which are small nocturnal creatures that are similar to ferrets. While animal markets are a huge way to pass new viruses to humans, says Lipkin, who has urged the closure of such markets for years because both the 1999 H5N1 flu, known as bird flu, and the 2002-2003 SARS outbreak were believed to have been started in such a market. It is not clear what animal is carrying the Wuhan virus, says Lipkin, who was an expert in identifying animal reservoirs for disease, and says he has offered his services to the Chinese government. It's possible, Mina says, that it didn't come from a wild animal market at all. It's not clear exactly when or where the outbreak began, with some genetic evidence suggesting it may have started as early as September 2019. Can our medical system prevent an epidemic? Also, how ready is the American medical system to handle any outbreak of Wuhan coronavirus? Sheila Doran, MD, an infectious disease specialist and hospital epidemiologist at Tufts Medical Center in Boston, says our hospital and many others are better prepared for such an outbreak than they were in 2014, when a man traveled from West Africa to Dallas carrying the Ebola virus. He infected 2 nurses in Dallas before dying of his illness, striking fear in the public among other healthcare workers. Everybody's come a long way since then, that's for sure, Laura says. Her main concern is that since it is striking at the same time as the flu virus, many people, because of their travel history and symptoms, will come under suspicion even though they won't have the coronavirus. It may tax our resources for private rooms and equipment, she says. If this were happening in the summer, it would have been easier to deal with. Still, for perspective, the flu virus kills 25 to 50,000 people per year. Mark Rupp, MD, an infectious disease specialist at the Nebraska Medical Center in Omaha, noted on a Facebook news conference Tuesday. There's a much higher level of risk from these more common viruses that we are used to encountering each and every year, he said. Could the coronavirus go away on its own? SARS seems to have burned itself out in one epidemic. MERS has bubbled along since 2012, sickening just under 2,500 people, mainly in Saudi Arabia and neighboring countries, and killing 1/3 of them. But it has not reached the level of a pandemic. Does this mean that the Wuhan virus might not become a pandemic? Leduc from Galveston says, like other viruses, you probably can't catch this one very easily, so it might never become the global disaster some people might fear. His team has been studying mice modified to have this human version of a receptor that allows a coronavirus to infect a person. With the genetic sequence in hand and awaiting a version of the virus, potentially from a patient in Washington, he says his staff can help figure out how dangerous the Wuhan virus is and begin to come up with vaccines and treatments to deal with it. Whatever we know now is likely to change because we know so little about the Wuhan virus, says Nancy Messonnier, MD, Director of National Center for Immunization and Respiratory Diseases. There is new information hour by hour, day by day that we are tracking and following closely, she said on a media call.